I'm happy to be here to talk about Learn because I am very excited about the opportunities with this Rehabilitation Research Network, and am very interested and on behalf of the Executive Committee to try to engage rehabilitation researchers, across the continuum and not just physical therapists. I mean, CoStar was focused on physical therapy, and this is trying to kind of go beyond that, and hoping that we can get some involvement of non-PT folks. We're still a little bit PT heavy starting out, but I think as folks get to learn more about this, hopefully we can expand the people that are engaging in this work. So here are my financial disclosures, just grant and contract support from NIH, AHRQ, and PCORI. So what I'd like to do today is to provide an overview of Learn and discuss some of the activities and opportunities, and then hopefully engage in a discussion of Learn's resources and future opportunities with you all, if you answer any questions and get feedback. So Learn is supported by NIH, specifically the National Center for Medical Rehabilitation Research under NICHD, and the National Institute of Nursing Research. And this is what's referred to as a P2C funding mechanism, which is designed to support multi-component projects and centers that will enhance the capability of research resources to serve the biomedical research community. And this P2C funding mechanism is geared towards rehabilitation researchers. We're closing in on our first year of funding, and been pleased with the activities that we've done. We're looking forward to growing and doing more as we go through the next 4 years. So Learn is just one of 6 P2C centers that are funded by NICHD. And the group of these P2C centers are referred to as the Medical Rehabilitation Resource Network. And perhaps some of you have interacted with some of these P2C centers currently or in the past. They've been, NICHD has been funding these P2C centers. I think this is, I believe, the third five-year round, or maybe the fourth. So why Learn? We feel like there's an urgent need to improve rehabilitation care by timelier implementation of evidence-based practice and de-implementation of suboptimal low-value practice. So Learn's mission is really to try to improve the quality and outcomes and value of rehabilitation care through stakeholder partner research, both within and across learning health systems. As Mike said, it's a collaboration of Brown, Boston University, and the University of Pittsburgh, and 8 healthcare systems, with one of which is Johns Hopkins. I'll talk a little bit more about these systems in a few slides. Some of them I'm sure look familiar to you, and you recognize them as health systems. We have some unique partners also that I'll get into more detail shortly. So the objectives of Learn is to create a learning health system innovation hub. That's kind of what we're calling our group of health system partners. And basically, that's kind of at the foundation of this, this network, really trying to do work where we engage patients, providers, administrators, and all the stakeholders, and doing this work in real world settings or real world care. Our second objective is to provide funding and methodological and technical support for scholars and pilot awardees. And then our third objective is to develop a knowledge repository where we have learning health system resources that are tailored to the rehabilitation community, with the goal of trying to advance best practices in rehabilitation learning health systems research. So just briefly, what is a learning health system? There's, as we know in science and academia, there's always several definitions of terms. I like this one. It's simple. It's a health system that combines internal data and experiences with external evidence to produce knowledge that is put into practice. You know, some key aspects of learning health system is that it harnesses data and analytics to learn what works best, and it feeds that knowledge back to create a continuous quality improvement cycle. This is, again, one of several ways that learning health systems are depicted, but I like this because it kind of talks about the three components of the learning health system cycle. Basically, data to knowledge, where you're kind of collecting data to understand your problem, and then knowledge to practice, where you're trying to apply that knowledge into practice and affect change, and then practice to data, where you kind of look at, okay, we've used this knowledge, we've made change, let's look at how we're doing by looking at data again, and you kind of start the cycle again. This is another way to look at it. I like this slide just because it really illustrates the goal of Learn, which is really to partner healthcare partners and researchers to you know, participate in this learning health system cycle. As far as learning health systems researchers and learning health systems competencies, the Agency for Healthcare Research and Quality actually convened a group of experts and came up with learning health systems research competencies and defined what a you know, learning health system researcher was. They saw the need for kind of articulating these competencies. You know, as far as health services research, they just looked at, they saw that it was something that was becoming more and more common. Implementation science was becoming more common, so they wanted to you know, capitalize on that and guide folks. So learning health systems researchers are embedded within a health system and collaborate with its stakeholders to produce novel insights and evidence that can be rapidly implemented to improve the outcomes of individuals and populations. They came up with 7 broad research competencies, which are listed here on the right side of the slide. And we'll talk about that information a little bit more detail as I go through the presentation. But these competencies are really at the core of our training and research activities that we're trying to promote through Learn. This is the kind of the organization of Learn. Linda Resnick is the overall PI of Learn. She's at Brown University, and she was actually the overall PI of CoStar, which Mike talked about at the beginning of this presentation. We've got an executive committee, and the executive committee members direct different components of Learn, and there are 7 components to Learn. There's the administrative oversight component, and then we've got these components here: promotion of center expertise, didactic interactions, mentor collaborations, which is the Learning Health Systems Scholar program that we'll talk about, pilot studies, and techniques development. And then at the bottom, collaborative opportunities, which is basically our health systems innovation hub. And we have that down kind of at the bottom as the foundation of this, because it really is a partnership, and we rely a lot on the health systems to participate in the activities and inform the activities. We also have an independent advisory board. Then I'll talk about folks that are on that in just a second. So here's the executive committee. It's folks from Brown, Pitt, and Boston University. We also have 4 project managers or staff that help support Learn. And they do a lot of the work, and we're very appreciative of them. There's Kristen wrestles at Pitt with me, and then Brown has a couple folks, and then Boston University has Derry. This is our independent advisory board, which we're thrilled to have these folks that have a lot of experience and prestige. Tim Carey, who's at the University of North Carolina. He directed the Shep Center for Health Services Research there for a long time. We have Charles Friedman, who is an expert in learning health systems. Brent James from Stanford. Tracy Liu, Ken Ottenberger, and Shoshana Sofer. So we've had one meeting with our advisory board. We plan to meet with them once to twice per year to get input. Again, Linda Resnick oversees the administrative component of Learn as the PI of the overall Learn. And I don't need to really read that. That's just kind of the administrative stuff. Mary Slavin oversees promoting center expertise component. And this is the component that develops and implements kind of learning activities and training activities to help engage rehabilitation researchers and help them become better learning health systems researchers. The Learning Health System Innovation Hub, as we refer to it, is our 8 partners. UPMC, Hopkins Medicine, Intermountain Healthcare, Cleveland Clinic, Boston Medical Center. There are all large integrated, somewhat integrated healthcare systems, some more so than others. But we also have F.A.P.T.A, who is the largest not-for-profit home health provider in the nation. And we have ACA-NCAL, which is the American Healthcare Association and National Center for Assisted Living. They represent skilled nursing facilities and assisted living facilities around the country. They do a lot of advocacy work for their members, but they also have access to, to the members to participate in learning health system activities. And then NavaHealth is a company that was started with the bundle payment initiatives that came out, and they were a service for post-acute care providers to try to help them deliver higher quality, more value-based care. Their customers have actually kind of changed now to more Medicare Advantage plans, and they're working more with payers, but again, with the goal of trying to improve the quality and value of post-acute care, and specifically in skilled nursing facilities and inpatient rehab facilities, but they're starting to move into the home health arena also. So we're thrilled to have this kind of diverse group of health systems. They represent diverse settings. They provide care across the lifespan, across different, rehabilitation settings. There's geographic diversity, serving urban and rural communities, and Boston Medical Center is a safety net hospital. So we're trying to, we have some access to a really diverse group up there. The didactic interactions component is led by Mary Slavin and Teresa Shireman, and this is the component that creates all the webinars and grand rounds and activities that Learn has been sponsoring this year and will continue over the 4 years. They've got a planning committee of folks from Brown and Pitt and Boston that help inform their activities. So outside of the executive committee. And this is kind of a summary of some of the work that has been done in this first year with the didactic activities. As I had said earlier, our work is guided by the Learning Health Systems core competencies and sub-competencies. And so just giving an example up here at the top, the core competency of informatics. There are sub-competencies under that of demonstrating the ability to use EHR data and clinical information systems, and then knowledge of how to link data sources to clinical data. So what the didactic activities community does is they try to find experts that can talk about these competencies, and they put on a webinar where these experts come, and then they follow it up with a grand rounds where there's more kind of discussion of applications by, perhaps a researcher or a health system representative. So we've been through 3 webinars, and 2 of them had grand rounds after them. We've started with just kind of learning health systems introduction, and then went into stakeholder engagement, which is one of the competencies of learning health systems researchers. And we're starting into system science. Brian Mittman will be presenting next week, I believe, and then Pamela Duncan will be following up with a discussion of the COMPASS trial after that. So these are our archived events that are available on our website, which I'll give you the hyperlink to it at the end of this presentation. So these are all available for anyone to view. And then, as I said, we've got Brian Mittman and Pam Duncan coming up with system science, that area. And then we've got Laura Schroeder coming in the fall to talk about the role of context or contextual factors in learning health systems. We just wrapped up our Rehabilitation Institute. Hopefully some of you may have been there in attendance. That was just last week. It was co-sponsored by Learn and CoStar. And we also had some support from NaviHealth. And that was a great 2-day event. Again, this is archived for folks to listen to if they're interested. And we will have an institute like this once a year, that may or may not be co-sponsored, but the goal is once a year we'll have an institute that addresses some timely topic. Learn is going to be participating in the Precision Rehabilitation annual scientific retreat, the first one for this new cycle of funding. And I know that precision rehabilitation is a big focus at Hopkins. So presumably you guys will be there or know of this. If not, again, it's open to rehabilitation researchers, and there's no cost. The pilot component is another component of Learn, and these are really kind of the funding opportunities that we have with the pilot component and the scholars component. So these are mentored pilot studies that are $40,000 inclusive of indirect costs. We put out a call for pilot applications each year, so we've already put out our call for this first year, but a new call will be coming out, I would say, in the late fall. We also actually had worked with Mike and others at Hopkins to put out a special call looking at Hopkins implementing the activity and mobility program within the Boston Medical Center, and we actually have identified a scholar for that activity, and hopefully it will follow up with the pilot work. And then we've got our mentored collaborations component. This is where we fund learning health system scholars. These are year-long programs where the scholar develops a relationship with the healthcare system, kind of learns about the ins and outs of the data, understands kind of the context of the system, and formulates a plan to address a system identified high priority problem. So both the pilot studies and the Learning Health System Scholar Awards are really focused on health systems priorities that the health system has identified. So if you go to our website, each of our health systems partners are listed, and they've got a list of priorities that are important to them. We spend some time talking with our health systems providers and coming up with kind of some common priorities, and then the health systems often have specific priorities that are kind of at the top of their list. that we try to work with and match with scholars. So the scholar funding is $15,000 total fund. So it's direct and indirect costs. So it's a modest amount of money, but the idea is that we found that when you work with learning health systems or health systems, you're trying to get a researcher in there, it really takes a lot of time just to kind of deal with all the issues around access to data and just for the researcher to kind of understand what's going on with the health system. So the idea is that these scholar opportunities are hopefully going to lead to pilot opportunities or some other activity at the end of the year. We funded 4 scholars in our first year, and we're in the process of funding 9 more in this, in the beginning of year 2. So here are the scholars that we funded in year 1, and these were actually individuals that were written up in our application for Learn. So these were people that we had kind of some relationships with through CoStar. And so Dr. Coyle is looking at transitions of care following stroke with UPMC. Dr. Johnson's working at Cleveland Clinic and looking at the value of PT in the acute care setting. Dr. Magel is working with UPMC looking at decision-making, data-driven decision-making for patients with low back pain. And then Tracy Mraz is an OT who's working with Intermountain Health and looking at home health care. We have funded 3 scholars for year 2. We've got, actually, we've funded Dr. Gore, who is working with BMC and Hopkins. This is the activity and mobility promotion scholar pilot opportunity that I referred to in the pilot component. And then we've got Rick Black working with ACA and CAL, looking at using the GG codes or data to analyze functional outcomes. And then Dr. Koja, who's working with Intermountain to look at knee osteoarthritis and telehealth. But if you look down here at the bottom, we're working with Hopkins to pair them with a scholar. We're still in the process of that. And that's going to be focusing, I believe, on kind of cognitive impairment and delirium for patients in the acute care setting. And then we're trying to match scholars with our other health system partners. We funded 2 pilot studies in our first year. Dr. Stevens, who is, okay, well, that's actually that's actually incorrect. Dr. Stevens is working with skilled nursing facilities to and looking at the use of EHRs in skilled nursing facilities. And then Dr. Young is working with Intermountain Healthcare and looking at an activity and mobility promotion program. We're in the process of selecting pilot studies for year 2. So we've had applications and are still in the process of reviewing them. The final component is that Learn has is called the techniques component. And this is really trying to translate learning health systems techniques and resources to the rehabilitation context. So we are using a survey right now to the rehabilitation research community, and perhaps you've received it over email, where we're looking at needs and interests of the community in regard to learning health systems research. And the reason we're doing this is that we want to kind of target areas that are of most interest to the research community. So we want this survey to kind of guide how we'll do the didactic activities and training activities in year 2. The information that we get from the survey will help us customize resources, and also we wanted to include the priorities of the Innovation Hub stakeholders in our resources and how we're customizing things for the rehabilitation research community. So this is a copy of the 1 page of the survey. You can access this here if you guys get the PDF. I was going to give the PDF to Mike or to Jack to make available if you're interested in these slides. But but you can also access it on the website, which I will show you how to get to that. But basically what we're doing is asking about the different learning health systems competencies, asking researchers, what is your knowledge about these competencies and what is your interest in learning more? And so we're hoping that the results of the survey will help inform what we try to focus on for year 2 and going forward. We're distributing this through professional organizations, and we actually had our project manager look at R1 level universities and get emails from from different universities that focused on rehab or that had rehab training programs, and then using our internal email list. So this is kind of a summary of the LEARN activities. I know kind of going through the organizational structure is probably a little bit, a little bit hard to kind of comprehend. But basically, we've got funding opportunities through mentored collaborations, our Learning Health Systems Scholar Program, and mentored pilot studies. And these are, all of these funded activities are partnering researchers with health systems and addressing a health system driven priority. And then we've got educational activities. We're aiming to have 4 webinars and 4 grand rounds per year. Having an annual institute. We're going to be actually having an annual stakeholder summit where we're going to be getting just together our health systems partners to talk about how the first year went and how we can help them advance learning health systems research in the next year. We're proposing 2 to 3 symposia or national conferences. We didn't really do that this year, but I think as we kind of get more settled, we'll probably be trying to do some other things besides the Institute. And then we are going to be providing consultations. Again, I think this is something that we haven't really tried to advertise a lot, but we do want to serve consultative services for individuals that are interested in trying to improve their skills as learning health systems researchers. And then the techniques development component is really just trying to maximize how we maximize the training resources that we're creating, so that we're really addressing the needs of the research community and really trying to to advance learning health systems research. And again, our stakeholder engagement is key, working with our health systems partners to inform all this work is extremely important. So here is our website. You can access the survey here if you haven't already done it. You can find out about training activities that are upcoming and archived events. We actually also have a resource page where we're starting to collate journal articles and websites on learning health systems. So it might be something that is of use for you if you're pursuing this kind of work. You can connect with us in various ways. You can join our email list. We're on Twitter, the website, and then Facebook. And then this is just kind of a one-page infographic that kind of summarizes LEARN, its purpose, and just kind of an overview of what I discussed during this presentation. So that concludes the kind of overview of LEARN. I'm open to answering questions. If folks have comments, thoughts, we'd appreciate it all. So thank you.
Janet, thank you so much for joining us and attending. I just open to the floor for any questions or comments. I
mean, I do really want to emphasize our desire to get people outside of physical therapy engaged in the pilot funding and the scholars. Again, I think we kind of have been funding the people that we know and the connections that we've had, and through CoStar, but we're really interested in trying to get other types of rehabilitation researchers with or without clinical backgrounds and involved in this, in our activities in this type of work.
I did want to mention, just so everyone's aware, and then Preeti, I think you have your camera on. I'm probably going to ask a question, but I believe Megan Byer did submit something. So, and from Hopkins, we are very committed to it being team folk, and you can see everything, I think, started, Janet, it's fair to say, through PT, because it was like that pipeline that was developed by CoStar.
Right.
And trying to extend. And so that's why from Hopkins, I thought Steve Wagner, Nicole Schechter, Annette Laveza, there are a number of different disciplines who are a part of the groups. And I think one of the pilots put forth was COG and delirium for that purpose. But he got the camera on there, so go ahead.
Okay. Hi, Dr. Freburger. Thank you for that wonderful overview. My name is Preeti Raghavan. I'm the Vice Chair for Research here in our department. So I'd love to understand exactly how, it sounds like the scope is very broad and you do want to expand beyond physical therapy interventions. I'd love to learn about the many ways in which we could potentially work with you. So what, when you're talking about expanding the purview, could you give us a little bit of sense of, would it mean different areas of research, or exactly how do you envision it?
Right. So, I mean, it definitely needs to stay within the realm of rehabilitation. So I think, we are committed to advancing rehabilitation research, but that can include so many things outside of, I guess what, a lot of people think of when they think of rehab, PT and OT. So, so that's one thing. So, the various professions, I mean, when we pilot sent out the survey, we sent it out to like nursing, rehabilitation nursing, prosthetics and orthotics folks, speech therapy, occupational therapy, psychologists. So, anyone in the healthcare team that in the rehabilitation healthcare team, which is, very multidisciplinary. So in that regard, trying to reach all types of providers and researchers, kind of addressing all areas of rehabilitation. I mean, how you could become more engaged is participating in the activities. We're always looking for people to help on planning committees, to offer input on, what types of topics we should cover. So that's one way to be engaged. And then just the health system priorities. I think, again, when we did this kind of for the application, we were focused on our CoStar group to kind of come up with priorities. But each year that we'll be working with the health system to kind of find out what their priorities are, how their priorities may have changed. And that would be an opportunity to potentially engage different people, because if you've got a priority that focuses on a certain patient population, certain types of providers, whatever is kind of at the top of the list for you. But anything, any engagement that anyone at your university could have with us to kind of help let us understand what you need and what you think is the best way to try to advance this science, because it's so dependent on the health system to be a success. So we really appreciate that and value that. And I think part of having this this presentation was, I reached out to Mike and Steve and said, I want to, we want to figure out ways to engage your, health system folks more. So,
Preeti, I just want to follow up on the priorities, and I see Pablo's ready to go. But we were given a survey at the beginning, and so the priorities are huge, and we come at things like, I wouldn't be caught up on the discipline, but the prior. So let me just read off what they are so the team knows. implementation of mobility programs in acute care. So that could be stroke, ICU, and like it could be anything, right? Transitions of care across the continuum, effectiveness of rehabilitation and surgical care, unintended consequences of the coronavirus pandemic, and team-based models of care and care coordination. I mean, those are huge topics with all types of leeway to bring in things, you know, all over from team perspective. So I just wanted you to have an idea. It's pretty broad, which is usually something we don't always get. So.
And it could, but it can be focused too if need be, because I know like with the scholar opportunity we're trying to work with Hopkins and some of the other ones, our health system partners have said, well, you know, we're doing this quality improvement project right now, and it's you know, we really could, you know, use some help or, you know, get some boost with this with the scholar. So again, I mean, it's really what, you know, what you need, and you know, how we can help you, and you know, hopefully it's a win-win situation, because the researchers are learning what it's like to, you know, to work with the health system and understand kind of how the research is different than, you know, doing, you know, R01 in the ivory tower where, you know, you're controlling everything. But, you know, we think it's so valuable, and, you know, we feel like this is really how we might be able to move the needle and kind of elevate rehab and its value.
I just want to say, I think it's really terrific too that you have this program. And we'd be, you know, I personally would be delighted to talk with you more and find a way to collaborate. In terms of the pilot funding opportunities, is that mostly for junior faculty? Or what level are you, what level of faculty are appropriate for that kind of funding?
Good question. It's for any level faculty. So, and you know, I mean, what we're finding is there's really not a lot of people in rehab that are well versed in learning health systems research and implementation science. I mean, I think we're growing, but you know, as in really all of medicine, I mean, I think this is something that, you know, providers across you know, all the disciplines are trying to develop and improve with. So there's no criteria as far as that. It's really just someone who's willing to work with the health system, and you know, and understand that they're not driving the research agenda, the health system is. So, I mean, I think that's kind of hard for some of, like with the scholars, you know, it was when their application. So I think we need to be a little bit clearer about that. But, you know, we're learning as we go along how to do this, because it's a new model. But the idea is, if, you know, a scholar has an interest in a particular area, general area, you know, it can be valuable for them to work with the health system and you know, address the problem from the health system's perspective.
So, Janet, Pablo Selnick here. I'm the director of the department. Thank you again for the presentation. This is great, and I am very much aware of, although maybe we haven't talked directly, I'm very much aware of a lot of activities that we have been doing in collaboration. Of folks in the faculty and the team have been doing, which is great. And I love that you're presenting this here, because I think there's opportunity to even expand that to more. So I really appreciate the conversation. Maybe following a little bit the lines of what Preeti was asking, can you speak a little bit about, so you told us that doesn't matter if you're a junior or a senior, but can you speak to us a little bit about how onerous is the application if you were to apply for the pilot or for the other one that is with the mentoring, and then how much you need to have things well put together? For instance, I want to work with my organization to test these ideas, let's say acute therapy somewhere in some location. Do I need to have a letter from the big hospital boss, or you know, what kind of level of degree of engagement and support this expectation to have when these applications?
Right. So the scholar applications are less onerous, but you know, the pilot study applications aren't extremely you know, hard. But the scholar applications really are pretty easy, in my opinion, because you're basically just kind of talking about kind of the area of interest that you have that seems to align with the health system, and then your experience, what you bring to the table, but also, what things you would like to learn or, improve upon with the scholar experience. The pilot studies, there is a review of the pilot studies, and I think that, it has to have some substance, but we recognize that, even what's proposed might not really turn out, as it's proposed. But if there's, a logical flow to it, the aims are clearly stated and the approach is consistent with the aims. We're not really, looking for the, I guess, like the, the scientific rigor of, like an R03 through NIH or something. So if you don't have, all the statistics and stuff like that worked out, that's not as much of an issue. It's more really proposing something that is consistent with the health system, that seems, and that, the person seems like that they could complete it. And it has some cohesion as far as an idea. So I don't know if that was a good answer or not, but we can try to, I think we have, with this first year, we've kind of learned that we need to maybe be a little bit more specific and prescriptive about what we're expecting with these applications, but they aren't expected to be, too demanding. Because again, learning health systems research is a little bit sloppy. I think, we recognize that, so.
Thank you.
Mm-hmm.
Thank you, Jan. Can I ask one more little question along those lines? So, for many grant applications, you need a track record. So you'd submit your bio sketch and you need to have a track record of research. But I realize here you're really looking at the translational piece, how, implementation science. So are you looking for a track record of NIH funded research, that kind, or are you looking for a passionate clinician who can implement, some of there are so many gaps between what has been recommended in research and what is actually done in the clinic. Are you looking to bridge that gap, through a passionate clinician?
Yes. Yeah. So, I think we are probably, we are looking, because it's, NIH and ICHD, I think they really are focused on kind of the rehabilitation researcher, but we can partner a researcher with a clinician, and then I think it could work. So we're open to, we're open to those kinds of arrangements. I think it would just have to be, we'd have to feel comfortable that it would, it seems like it would be successful. But we have a situation kind of like that already with one of our learning health system scholars at the Cleveland Clinic. So, I think it, the clinician that's interested in research and has the passion could definitely be, in the mix. I think those are the kinds of things that would be good to reach out to us if, once a call comes out to discuss it. We're there to kind of work with you. And as I said, both of the scholars and the pilot studies are mentored in the sense that, just trying to help keep folks on target and focused, and, to ensure that there's success. So I don't know if that answered it, but.
I did want to, Preeti, to your point though, I think what makes us unique at Hopkins and probably, Janet, what you're mentioning at Cleveland Clinic, and I would argue UPMC, is we're on both sides of the coin. So on one side, we have people that are, trained researchers looking for funding, but we also have clinical, passionate people invested that can totally benefit from the education components of this, but also they have the frontline questions of implementing evidence in the practice. And so, hey, great if that's a Hopkins person who applies for a pilot at Hopkins, but if not, if it's a Hopkins person implementing it somewhere else or someone from somewhere else implementing it at Hopkins, it's bringing those skills together. But I would argue that we have a lot of people that would benefit from the education, training, and concepts being put forth, even if they don't necessarily qualify, and Janet, you'd have to speak to this, to the actual funding.
Oh, right. Yeah. I mean, all the training activities and the webinars are open to, the entire research community and the entire health system community. And, we on some of the webinars that we've done, we've had our health systems partners commentate at the end, be discussants. So yes, I mean, the training activities and, webinars and the resources really are for everyone. The funding opportunities, I think they, we can have situations where you could have a researcher and a clinical person and potentially support some of the clinical person's time. The scholar money can be used for anything. So we do have some scholars that are using some of the money to support a clinical person or to support a data person at the health system. Likewise with the pilot funding, the pilot funding could be used to support clinical people on the team. So we're open to, there's not a lot of restrictions on how the money is used. So we're open to, to models that would work. I mean, really what we want to do is try to advance the science so that we feel like successful scholar years would lead to a project at the end of the year, lead to, kind of taking the work to the next step, either through pilot funding or, maybe the health system is interested in it enough to try to support the work. But we really want to, try to advance the research and elevate it to some degree. I mean, we know that health systems often want to, the answer yesterday, and they want to do the work quickly to get the answer. And we appreciate that. We also want to try to kind of elevate the work a little bit so that it's more impactful.
Hey, Janet, there's a question in the chat. It just says, is the scholar program open to fellows as well?
Yeah. Yes.
And I see one other one. Can we get, I would imagine, the slides you said would be available by PDF? Yeah,
I have a PDF, and yeah, please take the survey. The link's in the PDF, or you can go to the website. But we would love to, love to hear from all of you. If you have, obviously, if you have an interest in learning health systems research. If you don't, then you'll get kicked out of the survey right away. But if if you're interested in this field, and we would love to have your input on what you think are important things to learn about.
So I just want to be mindful of time. Janet, I want to thank you so much for presenting. Everyone on the call and beyond will get these out, and then we'll do a good job. Myself, Steve Wagner, we'll push out information from the Learn group we get these things for free. Free seminars, free web. So we just gotta, I think make it louder and it just not go into people's spam. And I appreciate all the emails and webinars you all get. So we'll try to get loud. P.T., maybe we'll work with you a little bit when those things happen. Like what, maybe they're key people we should have attend. And beyond that, if you all have questions, and I appreciate you can reach out directly to Learn, but feel free to reach out to myself and Steve Wagner, and we can try to direct the question and make sure you get answered. But Janet, again, thank you so much for attending. And
yeah, thanks everyone for your attention. And yeah, P.T. and Pablo. Yeah, I mean, I think with the Health System Summit, the summit that's coming up in the fall with the health system leaders, we would love to have you participate in that. And so we'll reach out maybe to try to see if you would be available, and anyone else. That summit is for kind of our health system partners, so there'll be more information about that coming up.
Absolutely, happy to learn more. Absolutely.
Yes.
Thank you.
Same
All right,
here.
thanks everyone.
All right, thanks everyone.
Thank you. Bye-bye.
Bye-bye.